all know that in December 2019, there was an outbreak of cases of pneumonia of unknown origin in Wuhan City, China. By 7th of January, the Chinese scientists were able to isolate the virus and named the virus as novel coronavirus 2019. Initially, people thought that it was a zoonotic transmission which emerged from seafood market of Wuhan City, which also traded live animals. But now we know that there is person-to-person transmission of the disease. By March 2020, WHO termed this disease as pandemic. Now, why was it called novel coronavirus? It was because it was a new strain which was found in humans. New strain means we know nothing about the pathogen or the disease. So the medical fraternity got into the process of identifying, learning the disease process. People started looking into the pathophysiology, the molecular structures, and also into the vaccination. As a clinician, this was a time when patient taught us how to go about this disease. So we had numerous papers which got published regarding this disease and which helped us to understand the disease in a better way. So this was one of the papers which got published in Lancet in early February 2020. So this study was to look into the clinical features of patients who were infected with novel coronavirus. The patients who were suspected of novel coronavirus were admitted into one designated hospital in Wuhan City. The time duration was between 1st of December to 2nd of January 2020. Prospectively, data was collected and analyzed for all the patients who were confirmed of novel coronavirus by reverse transcriptase PCR. By January 2020, we were able to enroll around 41 patients. Let's see what the data shows us. Out of these 41 patients, approximately 73% patients were male and the mean age group was around 49 years. If you look into the associated comorbid conditions, 32% of the patients had some comorbid issues. Out of them, diabetes was around 20%, hypertension and coronary artery disease 15% each. Now out of 41 patients, 27 patients, that is 66% of the patient, had some association with the Wuhan's seafood market, and there was one family cluster who were found to be positive. If you look into the clinical features, 98% of the patients had fever, cough was seen in around 76% of the patients, and myalgia was seen in 44% of the patients. If you look into other minor complaints, which was sputum production, hemoptysis, headache, and diarrhea. Now, going to the lab, 63% of the patient had lymphocytopenia, and abnormal CT scan of chest was seen in 100% of the patients. The most common complications were acute respiratory distress syndrome, which was in 29% of the patients, and around 12% of the patient had acute cardiac injury, and sepsis was seen in 10% of the patients. What was noticed here was out of 41 patients who had novel coronavirus, 55% of the patients had dyspnea within 8 days of the onset of illness, and 27% of the patients developed ARDS, out of which around 39% of the patients required an ICU care. Overall, 32% of the patients required ICU care, and the mortality was around 15%. Now, if you look into the patients who were non-ICU, the patients in ICU had a higher plasma level of inflammatory markers like interleukin 2, 10, interleukin 7, IP10, MCP1, and TNF alpha. So the conclusion what the author gave from the study was the novel coronavirus 2019 had clusters of severe respiratory illness which caused similar symptoms like acute respiratory distress syndrome and was associated with ICU admission and high mortality. Now genetically, if you see, this novel coronavirus had 80% similarity with SARS-CoV-1, which was earlier seen in 2003. Hence, now the novel coronavirus 2019 is again renamed as SARS-CoV-2, which is severe acute respiratory syndrome coronavirus 2. And the disease, which was earlier caused virus-infected pneumonia, is now renamed as coronavirus disease 2019, also known as COVID-19. So what was the insight of this study? The most common insight was the patient came with a history of fever, cough and myalgia, and lymphocytopenia was most prominent lab investigations. Most of the patients developed respiratory illness and the mortality was on the higher side. Mortality was also high in patients who were requiring ICU care. Now this was a very small study which was seen in 41 patients. We have a larger study again coming from the Wuhan city, China, which involved 2 hospitals. Now although it was one of the initial study which got published, nevertheless the numbers were very few. So there's another study which got published and it was again from Wuhan city, China, where 2 hospitals were taken into consideration. I'll be sharing the details into my next video. So thank you for watching and be safe.